Yeah, you can start.
Okay, good afternoon, everybody. Thank you for inviting me to share this session. My topic is COVID-19 as a multidisciplinary critical problem. Now, this slide in front of you shows the challenge that Singapore went through in the last 9 and 3/4 months, starting from January the 23rd, when we were the first case, and then subsequently, as things are getting controlled, we found that there was a big to the people stay in the dormitories. And we had the highest number on the 20th of April with 1,426. Following that, of course, there was a lot of effort to try to control the infection there through this wearing of masks, hand sanitation, and also safe distancing. And with that struggle, we eventually went on to control. But you can see that in August the 5th, there was a spike at 908. We persisted with the mask, hand sanitization, and safe distancing. And today, we are happy to announce that we had 3 cases yesterday. Right? Can I move on to the next slide? Okay, Hong, are you able to?
Yes, I'm trying to move it. It doesn't seem to move.
Oh,
Doesn't seem to move. Right.
not able to move.
Yeah, it doesn't seem to move. Okay, hold on. Okay, let me just do it again. Okay, yeah, can you see it?
Okay, not yet. Let's wait a while.
Can you see it? Okay.
Okay, right. So I have 5 points to share in the lessons that we learned. The first lesson is that it's important to train everybody to be aware of how to provide self-care, right? Now, in the provision of self-care, there are several things to pay attention to. We need to get everybody to maintain a healthy diet, sleep properly, stay active, and make social contact. Children, especially, need quite a lot of care because this is something that they have not sort of experience in. It's important to say that we need to maintain routine schedule and lead life as normal as possible. It is also likely that we can be stressed out, feel sad. Now, if that happens, we need to look for help. Okay, right. Let's move on to the next slide. So the next slide, this is the probably the most important slide, is that the prevention lies in three things: wearing a correct mask, making sure your hands are sanitized, and also safe distancing, meaning that you need to stay about 1 arm's length from each other. Okay, the next slide shows something about the mask. Right, you can see there are many kinds of masks. Okay, so the best mask for everybody is actually the surgical mask, which is number 2 there. Right, all the other masks protect to some way, but it's not as good. So it is therefore important to get the right mask. Okay, next slide. Now, it's also important to note that some of us are more vulnerable, right? And that's my third point. So, based on what we know, there are several groups of people: people who are old, people who have got diseases, various sorts of diseases, people who are overweight, and also people who have diabetes, right? Now, what do you do if you are high risk? Well, it's important to limit your contact with others and practice the mask, the hand sanitization, and self-distancing. Okay, and we move on to the next point. Okay, this is just to show that people who have risk factors then have a bigger risk of catching and suffering from COVID-19. And you can see that obesity has got 3 times. And if a person has multiple health problems, can be as much as 5 times the normal people. So it is important to realize that if you are high risk, you need to take care of yourselves. Okay, next slide. Okay, then we move on to the fourth point. The fourth point is quite a number of things. First is that each of us need to know the symptoms of COVID-19. Essentially, the first two, fever and dry cough, are the main symptoms. And this is unfortunately so for only 50% of people. If 50% of people, they actually got no symptoms at all. Right? Now, what about diarrhea? Diarrhea is more a problem of the children. Okay. All right, say we move on to the next slide. So it's important that the public understand these the symptoms and look for help the moment they have these symptoms to seek medical help. Next slide. And of course, in the front line, the primary care physicians has got to be ready, and they need to be properly equipped with mask, gown, and glove, as well as face shield if they are dealing with highly suspicious patients. It's also important that the movement of patients should be one way. Don't go back, then you infect all the other people. And people who are likely to be infected should be put on a special queue and wait for the ambulance to take them to hospital. And don't mix up with the rest of the patients who have got no fever or no risk. All right, then we move on to the last slide. Now, this last slide shows what to do if you are dealing with sick patients. So we have a national center in Singapore. That's where we house our very ill patients. For those who are not ill but infected, we have these community isolation centers where we make use of the exhibition areas, the old army camps, the old schools, and then house the infected people there. And that is an important concept because you take the infection out of being all concentrated in the national center. Okay, with that note, we move on to conclusion. I have 5 points to make just to remind ourselves. I will go through slowly. The first point, of course, is to train everybody quickly to provide the supportive self-care I talked about. Number two, we need also to train everybody to practice MHS, correct wearing of masks, hand sanitation, and safe distancing. Number three, we need to look at the high-risk people, teach them how to protect themselves, and we also need to protect them. Number four, important to recognize the symptoms of COVID-19, chiefly the fever and the cough. And if that is so, seek help. We need the frontline doctors to be ready. So that is important in every country to make sure your frontline doctors are ready as well as well equipped. And number five, for people who are very sick, they need to be treated in the national health, national disease centers. However, for those who are not so sick, it's a good idea to treat them in community isolated centers so as to free up the hospital beds. So with that note, let me thank you very much for your attention. We'll take up the discussion later on. Thank you, Kai Hong.
Right. Thank you very much.
Yes, hello. Mm, mm.